Hello, my name is Denise McLellan. I'm the Managing Director for Forward Thinking Birmingham. I'm pleased to say that we've made good progress since my last blog, when I outlined to you some of the key milestones between now and full delivery of Forward Thinking Birmingham in April 2015. GPs I meet keep asking me when they will know how they refer into the new service, and I'm pleased to say that we'll be sending out detailed referral information shortly. Today, however, I want to concentrate on the essential role of the voluntary and community sector. The voluntary and community sector plays a really important part, particularly on early intervention and preventative services. And part of our vision for Forward Thinking Birmingham is that we want to increase spend on these by reducing spend on the more intensive interventions. And we are committed to reallocating that spend to the voluntary sector. I met with a group of senior voluntary sector leaders recently, and we talked about how we could achieve that vision. What was clear is that we had a lot in common. We all shared a passion for improving outcomes for young people. And we all recognised that by more closely integrating our services, we could provide better services at the right time for young people and their families. We also noted that we shared one key risk, which is that of matching supply and demand. With our new Forward Thinking Birmingham information system, we'll be able to monitor that demand in much more detail than we have done previously. And with our commissioners are committed to working out ways that we can manage that better. When we met, we also agreed a number of very practical steps to improve the way we work together. The first of those was to increase the voluntary sector board voice, the voluntary sector voice at board level. We also agreed that it would be helpful to include some senior voluntary sector leaders in our local transformation leadership programme. We will also be working out how we can share data more carefully and more clearly across the different sectors about demand and capacity and services offered. I hope this has been a helpful summary of how we're working with the voluntary sector and also how we're going to be working with schools and other statutory partners in delivering improved mental health care for young people. If you've got any questions, then please write to me. If you'd like to read this blog in more detail, then there's a written version of it on our website. And if you've got any ideas for future blogs, then please also let me know. We intend to focus on the role of Beacon, our system management partner, and our proposed city centre hub, where you can walk in and get support for mental health problems. Thank you for listening.